Hello, and welcome to Voices in Leadership from the Harvard T.H. Chan School of Public Health. I'm Eric Anderson, the director of this program, and it's my pleasure to welcome you today. Our goal with Voices in Leadership is to focus on effective leadership to create positive change in public health. Today we welcome Helen Clark, Prime Minister of New Zealand from 1999 to 2008. She was the first woman to become Prime Minister following a general election in New Zealand, and the second woman to serve as Prime Minister. Throughout her tenure as Prime Minister and as a Member of Parliament for over 27 years, Helen Clark engaged widely in policy development and advocacy across international affairs, economic, social, environmental, and cultural spheres. In April 2009, Prime Minister Clark became administrator of the United Nations Development Program. She was the first woman to lead the organization. At the same time, she was chair of the United Nations Development Group. She completed her tenure in April 2017. In 2020, Prime Minister Clark co-chaired the Independent Panel for Pandemic Preparedness and Response to evaluate the world's response to the COVID-19 pandemic. In July 2021, Prime Minister Clark and her co-chair, President Ellen Johnson Sirleaf, presented their findings to the UN General Assembly. In our program today, she will be joined in conversation with Harvard T.H. Chan Professor Mary Bassett, Director of the Harvard FXB Center for Health and Human Rights, and the incoming Commissioner of Health for the State of New York. Professor Bassett, I turn this program over to you. Thank you.
Thank you, Eric, and welcome to you, Prime Minister Clark. It's a real pleasure to have you with us. I'm looking forward to our conversation.
Thank you.
So one of the benefits of having a really long and varied career is there's an awful lot to talk about. And of course, you remain extremely active today. But I thought we might start back with reflections on the many firsts that you've accumulated in your working life. You began as a member of parliament, went on to become a minister, held several portfolios, including health, and then became prime minister. So you really have had a life driven by a passion for service. And I wonder if you could just reflect on what accounts for that kind of drive and where you think it came from. I know you started out as the daughter of a farmer.
And more than that, Mary, as the eldest daughter of a farmer. And if you often look at, who comes forward to leadership, how often is it the eldest in a family who's been the leader of their little, family of siblings? So that was me. Also, I often reflect on the fact that I was very lucky to grow up on a farm in the 1950s with no brothers. Because if you had brothers on a farm in New Zealand in the 1950s, the boys got to do things and the girls did things with mum. The boys did things on the farm with dad. So Dad had all girls, and the girls did everything. And it never occurred to me that girls couldn't do everything, because we did. And I went through this charmed life, if you like, as a child on the farm doing everything. I went to an all-girls grammar school for my secondary schooling. I went to university at a time when the girls were going in as great numbers as the boys were. But when I got to the university for the first time, it was very obvious to me that suddenly there wasn't a world of women. My girls' grammar school was run by women. And suddenly at the university, there were very, very few women staff. And then it started to sort of dawn on you that not everybody felt the way my family or my girls' grammar school had, that women could do everything, and became a bit more of an uphill struggle after that.
Well, I wonder in the course of all that, if you can identify any particular individuals who you thought were role models for you. I mean, you are today a role model for many people, including women and young girls. Did you have identified heroes? Sounds like your dad was one of your heroes.
Yes, my dad was one of my heroes and is actually still going strong 99 years and 8 months, and I spend a lot of time with him. My first female role model was my mother. My mother was a teacher, and I always thought I would be a teacher because Mum had been a teacher. I had a very influential aunt who was also a teacher and put a lot of time into me, bringing me up to the big city to do things in the school holidays and away from the farm. And then I had these influential women teacher role models as well. I had a history teacher at my school in Auckland, a boarding school, who in the mid-1960s was talking to us about the Vietnam War and accustoming us to thinking of a world outside our little bubble in New Zealand. And then when I went on to university, there was a particularly influential woman professor in the Department of Political Studies where I majored and later taught. So all of those women were very influential in my life.
Yeah, I've been thinking, and I get asked myself, whether we think that women as a group have a particular style of leadership. We all can think of women leaders who were, very autocratic and bullies even. But as a rule, I think people imagine women leadership as being more inclusive, relying more on teams, and maybe being driven by greater sense of empathy. Could you just talk about that a little bit? And I mean, you're among a really kind of elite tier of women leaders globally. I'd really be curious to hear what you think about that.
Well, I think there's been a generation of us who've been able to come into leadership and be who we are, not having to mimic men's leadership styles. So if you look at the generation that I'm part of, or just a little bit older than I am, Mary Robinson of Ireland, Gro Harlem Brundtland of Norway, there was a cadre of us out of small, democratic countries who were able to be the kind of lateral, horizontal head of a collective, primus inter pares kind of leaders that we now so often associate with women. But there was an earlier generation like Margaret Thatcher, where if you think of the times in which she rose to lead the Conservative Party of Britain, could you have had the kind of leadership that I've just described? I don't think so. I mean, she had to, deal in a very different world. And then you had the other women leaders who came, for example, out of South Asia, and often out of ruling families there where there was a family connection. Mrs. Gandhi, whose father had been the Prime Minister, Benazir Bhutto, of course, more my generation, but Dad had been the Prime Minister, the still serving Prime Minister of Bangladesh. His dad was the Prime Minister, the Sri Lankan Prime Minister whose family was in politics. So very, very different context. But I think our generation was able to set a tone for women who could be themselves and be comfortable in their own skin with that flatter style of leadership, more consultative, not dithering. I don't think consultation to the point of dithering is helpful, but flatter and more collective, if you like.
Yeah, no. We have so many crises going on in the world, and we'll come to some of them. We have COVID, which has displayed so many inequities around, between and within countries. We this coming Sunday will begin the COP 26, and all eyes are on the progress in addressing the climate crisis. And it's had me thinking about the global response and the idea of empathy, and maybe even more broadly, solidarity. I wonder if you could just say a little bit about the role of empathy in leadership. And I don't know, just if you could just talk about that.
Well, I think empathy is extremely important because, if leadership's not about people and about service, what on earth is it about? But we do see some appalling, examples of, quote, leadership, and I put in quotation marks, where there's no empathy, almost contempt for people. And well, we don't need to, I guess, think too far from where you are in the United States. It was a terrible period your country has been through, or thinking further south into the South American continent, another example today as well. And both examples, by the way, characterized with the most shocking approaches to COVID, almost of denying science, letting fake news spread, the death toll be far higher than it should be. I mean, how do populations put up with this? I can only say in a small country like mine, such a leader would be just drummed out of office. It's unthinkable, but somehow these people have got away with it. And it is fair to say, when we look at women's leadership on average through the period of COVID, it has been characterized by far greater levels of empathy, also, shall I say, far less narcissism than these worst examples of male, quote, leadership, being prepared to listen to the science and the public health advice, and to communicate and not pretend you know everything. Because when you have a novel coronavirus that explodes onto your horizon as a leader, you're scrambling, right? No one really understands this thing. And you have to go with the best advice you can, which won't be perfect. We can all look back with hindsight and say, well, why didn't you do this or that? But at the time, it wasn't always so obvious. And I think the women leaders, by and large, with this less narcissism, more empathetic, sort of task focus. What do we do here? Who do I listen to? Get the best brains around me, and communicate to people. That's been the approach of the Prime Minister of my country, Jacinda Ardern, the Scandinavian women leaders, Angela Merkel, of course. There's been some stunning examples, and it's been hard going, and it hasn't gotten easier as the variants like Delta came along. But by and large, you have to say they've done a pretty good job.
Yeah, no, I mean, I really have to come to the very bold moves that New Zealand took initially and has just recently indicated that it will sort of step back from, which was that it would aim for zero transmission. You're an island state, so you have the opportunity of elimination. I'm someone who's thought a lot about equity, but clearly elimination is always the most equitable strategy, because then nobody is affected. And as you point out, it's been it was led by I wasn't sure how to pronounce. I'm not sure. Everybody seems to call her Jacinta, so I apologize if I can't. Is it Ahern or Ahern?
Ardern.
Ardern. Okay, who's the Prime Minister? Can you just talk a little bit about how you've responded to have you spent COVID in New Zealand by and large, and how the whole population had to agree to quite extreme measures in order to get to zero transmission. But it turns out that the virus is just too clever in terms of its ability to mutate, not in New Zealand maybe, but elsewhere in the world. And it's hard for any country to be truly an island.
So it's an interesting story. And, like you, I've spent, most of the past 18 months and more, very, very focused on COVID and how it's handled globally. And of course, keeping a close eye on what's happened in my own country, which is seen as having one of the more successful responses. And we can talk about the global response a bit later. But one of the really shocking things is how little was done by most countries after the WHO declared the public health emergency of international concern. And I think it's because the world had dodged a bullet for over a century since the 1918 flu epidemic. Of course, there'd been other major epidemics, but nothing like a global pandemic of the scale. So New Zealand, like most countries, actually didn't do a lot after Dr. Tedros declared the epidemic. One thing we did do, and this was really against WHO advice, which tells you something about what needs to happen with the advice, we did stop travel from China and then from Iran. And then by the time the pandemic had exploded in Italy, from there and everywhere else as well, travel constraints, closing the border were a critical part. But I dug out a press statement when I was researching this for one of many presentations on the subject a while back. And on the 28th of February, the New Zealand Ministry of Health nonchalantly put out a press statement that said, "We have detected the first case of COVID-19 in New Zealand. The risk of community transmission is considered very low." Well, hello. That was never going to be true. Heaven knows who wrote it. So we weren't doing too much apart from closing the border to certain people. And what the government did, it dusted off the flu pandemic plan. Now, the smartest thing it did somewhere around mid-March was throw out the flu pandemic plan, because this isn't flu and the plan wasn't relevant. One tool, well, we had tools, of course, in the legislative toolkit. We had the Public Health Act, which, public health acts around the world, you've got quite draconian powers if you're prepared to use them. Also, as part of the learning from SARS, which was a dog that didn't bark for New Zealand in 2003, we did, in my time as Prime Minister, pass an Epidemic Response Act. And they had the tools that were in that as well. But then they really started to scramble, because as it became clear that the 28th of February press statement was complete nonsense and there was already was community transmission starting, they had to move fast. And that's when they came to the view that because we're an island nation and we could close borders, we could actually stamp out this outbreak. And we went for the elimination strategy with a very tough 7-week lockdown across the whole country. And everybody kind of sat back and took it and thought, yep, we can do this. We're capable of doing this as a country. And that original virus that came around was, of course, not Delta. If we'd been hit with Delta straight up, that would have been harder. So after that first lockdown, we closed it out. And actually, for most of the period since the fiat was declared, New Zealand has lived COVID-free. We've carried on with a life where we go to the theatre and the stadiums and no one worried about anything too much. We had the occasional outbreak, but the official approach was elimination. Now, you can look back at it and say, look, we had a number of missed opportunities to get more stuff right, but hey, that's all hindsight. Now, what has changed, of course, is Delta, but also what's changed is vaccines, which we didn't have in 2020. Our vaccine rollout has been a bit slow. I think in New Zealand and Australia, you're a bit at the end of the global supply chains. And we in Australia, they opted for an AstraZeneca strategy and then changed to Pfizer. So that disrupted an orderly rollout. In New Zealand, we had a range of options, but then opted only for Pfizer. So that then had supply chain issues. So suffice to say that we've been scrambling to get a major vaccine rollout with this Delta outbreak, which began in mid-August and which has seen Auckland closed down now for about 10 weeks and a region to the south of it, sort of closed down for a lot of that period as well. So it has been tougher. Now, what is Jacinda Ardern and the New Zealand government and people grappling with at the moment? That there is a limit to the time at which you completely seal your borders. At some point, you're going to migrate, particularly in the face of Delta, to a different kind of strategy. And it is like a grief process for New Zealand, because we've been used to just say, we're going to lock this thing out. But there's also a weariness, and a lot of populations see the weariness. Auckland is wondering whether it's going to be able to get out at Christmas. A lot of people have their beach houses they want to come to. Can they get out? So what they're moving towards is the target of 90% vaccination, which is achievable. My great city of Auckland is now over 90% first vaccination. Parts of it, well, actually pretty close to over 80% second vaccination. The rest of the country, which hasn't had as much of a shock as Auckland, it's lagging a bit, but it's doable. But what we're noticing, Mary, is you cannot go from no public health controls to a vaccine-only strategy and expect to succeed. You must keep public health controls. And so what has been signalled by the New Zealand government is that you can expect ongoing controls. They've also very widely mandated vaccines now, and that's helping get the vaccine hesitant through the door, because of the vaccine hesitant not only can't go to the hairdresser or a concert, they can't work there either. That starts to really get down to the hardcore anti-vaxxers who won't walk through the door of a vaccination clinic. So that's what we're moving towards, a very high level of vaccination, but ongoing public health measures relevant to the epidemiological state of the epidemic at the time. And I think those controls they'll be considered.
I mean, what people here call non-pharmacologic interventions,
Yes.
masking, distance,
All of that.
contact tracing,
Vaccine mandating. Yeah.
quarantine. Yeah.
So you're going to have to show your vaccination certificate to or app on the phone to get into the restaurant, the bar, the concert, the this, the that, the other. And you can't work in a restaurant, a bar, a hairdresser, a long list unless you're vaccinated.
So the mandates are mostly based on employment, on employer mandates. So it's part of worker safety, really. I mean, that's
It's worker safety. So every teacher starting the school year next year has to be vaccinated. Everyone working anywhere in the health and disability and person-to-person community care has to be double vaccinated by the beginning of December, or you lose your job. That's the reality.
I really want to make time to talk about the independent panel on pandemic preparedness. But before we move off vaccination as a strategy, and as you know, there's been a debate in the United States about mandates. There are a growing number of mandates. Governments are requiring mandates in some cities for all of their employees. Unions have come out in some settings in support of these mandates, and others they have been critical. But it remains pretty contested, and there are groups that have low vaccine coverage rates. We're not at approaching 90% as a nation. I haven't looked at the most recent number, but probably it's more like 2/3. Although we have people from 12 up are now vaccine eligible. But there are groups characterized by their political disposition, with Republicans much less likely to be vaccinated in this country, in the US, than people who are Democrats. And then there are racial ethnic minority differences. And today in the Boston Globe, our local paper, there was a piece about the Maori in New Zealand, and suggesting that the vaccine coverage varied substantially by ethnicity in New Zealand. And I think it's something under 50% of vaccination coverage among the Maori, as compared to much higher among other groups, whites, Pacific Islanders, so on. Can you just talk a little bit about that? And it's a shared concern. We both are countries which have mistreated our indigenous people. No,
there are quite distinct differences at this time in the vaccination levels across the different ethnicities. For European New Zealanders, it's pretty high. For New Zealanders of Asian descent, it's very high. For the people of Pacific Island descent, it's actually not too far lagging. But for Maori, Indigenous New Zealanders, it has been significantly less. And I checked what are more or less the latest figures. If you go to double dose vaccination for the whole population, it's currently just hovering around 72%. First dose, obviously getting closer to 90 in Auckland, and in the 80s for the whole population. However, double dose for Māori, 55.5%, and single dose, 62%, probably a solid 20%, 20 percentage points behind. So, what can explain this? There's the obvious factor that the demographics of the Maori population are significantly younger than for those of European descent, for example, although not markedly different from those for Pacifica descent. So you come to other deeper structural factors which do have their roots in colonization and marginalization. So there is now a huge effort to reach out more effectively. What we know is that different approaches are needed for different populations, and you need the leadership of communities, and in this case the Indigenous community, to be supported and have the means to promote the rollout there. But by the way, the vaccination rate for older Māori is pretty close to the public average. It is younger Māori who have not been coming forward as much. But let me make one more point, and that is, we all know the saying, none of us are safe till all of us are safe, and we've tended to use that as a global catch cry because it is disgraceful that the rollout of vaccine in sub-Saharan Africa is still probably under 5% population. But the same applies in our own countries, not only on ethnicity-based grounds, but also in other areas of marginalisation. And among those areas, of course, and this is very relevant to the United States as well, as people who use drugs, who are very, very marginalised, or sex workers. Because when the authorities come along and want to start contact tracing and so on, voices of authority often confused with, is it the police who are after me? If there's a public health imperative, then frankly, put law and order to one side and focus on the health. And not everyone's got that message. So really, there's many parallels, I'm sure, with the US.
Yes, absolutely. I mean, the currency of public health really is trust. And in the United States, the criminal legal system has not often been worthy of that trust. And it's been really a shame to see public health sort of tarnished by that. I do want to come to talking about the independent panel for pandemic preparedness, which you co-chaired with Ellen Johnson Sirleaf. And if you could, you've issued a report. You've made several recommendations. If you could just tell us a little bit about this effort. You made some very sweeping statements about the fitness for purpose of the global pandemic response, and it would be great to hear what you've recommended.
Yes, and the report got great coverage, including in the New York Times and Quality Press in the US and around the world. I mean, we found a lot of failures, but the whole point is that these reviews are important, because who wants to go through this experience again? We could learn from this. We could do things differently. One thing we can't account for, of course, or can't be accountable for as a global community, is bad political leadership. And again, if you have leaders who just refuse to do anything sensible, even the best equipped public health bureaucracy is going to struggle, as we know, again, to make a point close to home for the US. But no, there's a whole series of failures. I mean, we are critical of the slowness of response in January in China. We're critical of the international health regulations not empowering the WHO sufficiently I mean, it has no right to go to the scene of an outbreak fast and try and establish what the facts are. It has no right to publish information about a country without a country's permission. And if countries aren't particularly cooperative, that slows everything up. It feels disempowered to act in a precautionary fashion. The international health regulations want it to assemble every last bit of evidence. When you have a fast-moving respiratory pathogen, can you afford to wait for that? We don't think so. So we make a whole lot of points about that. But having said that, as I referred to earlier, Yes, January was a month of lost opportunity before the virus moved in a big way outside China. But February was just, I mean, it's horrible, the lost opportunity of February, where most countries sat around and thought, oh, how terrible what's happening in China. And then, oh, terrible what's happening in Iran. And then, as I say, suddenly it exploded in Italy.
Yeah.
And then, start to explode in your own country and Western Europe, and it was away. And that probably mid-March was when the world started to wake up. But hey, it was on the move. And then, we do feel the international health regulations of 2005 were a hindrance, not a help. In so many forums I've been on with Gro Harlem Brundtland, who was WHO Director General at the time of SARS, she has said that if she'd been stuck with the current international health regulations, she could not have been as effective as she was in dealing with SARS. Well, hello, doesn't that tell us there's a need for change? And yet the International Health Regulations Review Committee said it was all about implementation. There was no need for change. We don't agree with that. We think there needs to be new legal powers for the WHO, and there needs to be a new legal instrument that spells out much more clearly what the obligations of member states are. And that, hence the call for the new legal instrument, pandemic treaty, convention, whatever.
So the new framework convention. I'm mostly familiar with the framework convention for tobacco control, which is,
yes,
I know, was the first framework convention that had a health purpose, but maybe I may not.
No, you're right. You're right, Mary. And I was a young Minister of Health in 1989 who went to the World Health Assembly and raised the flag and said we need a framework convention on tobacco. I was there at the start. But that's the only one the WHO has ever negotiated. Yeah. And so the call has been to negotiate, I think it's Article 19 of the WHO Constitution, to negotiate a framework convention around pandemic preparedness or response, which would supplement and fill in the gaps left by the international health regulation. So to cut a long story short, our panel's recommendations, we have recommendations on the immediate situation, which is dealing with the pandemic now, but we have a package of recommendations on the global system, starting with leadership by a head of state/government level, a Global Health Threats Council as like an Uber monitoring body across the international system. This is more than about health, right? This pandemic has implications across the society and economy, and that means a lot of agencies, as well as the health ones, have to come into play.
Under the Secretary General.
Well, look.
Would it sit at the WHO, or would it?
No, it wouldn't sit at WHO. It has to be, we believe, above and beyond WHO. We think it should have a mandate from the UN General Assembly. Look, it would be simplest if the Secretary General, using the authority of that office, actually selected the council or selected the chairs. They would then present a slate. It could get General Assembly endorsement or SG endorsement. We have called for a special session of the UN General Assembly to approve a political declaration on the package of reforms. This modality, by the way, is well known in health. It's obviously been used for HIV/AIDS over the years, universal health coverage, non-communicable diseases, antimicrobial resistance. We're well used to tackling issues with major health dimensions at the General Assembly through a political declaration. So the declaration should cover the Leadership Council. It should cover support for a dedicated financing mechanism, which we say should be on an ability to pay basis, from those according to their needs to each according to their means. We say it should encompass support for the new legal instrument. It should encompass support for a redesigned Act A/COVAX, access to COVID tools accelerator, because the market model that it's based on has not served the world well. And look at the aspirations there were for COVAX and for rolling out vaccination to low-income countries. It's just so far off the mark. And then we say that the declaration should also cover the strengthening of WHO, its independence, more baseline core funding, less tagged funding, and a fixed single term for the Director General. So that's the package of reforms we recommend should be put in place. As I say, we have specific recommendations for the immediate situation as well, which we can come to. But we need big picture thinking now. Now, is it going to happen? Look, we are continuing our work at the General Assembly. We have some very forward-leaning countries and permanent representatives there who, as we speak, are doing the hard yards on this. And we remain hopeful that the General Assembly will step up. The Secretary General, in launching his visionary statement, Our Common Agenda, in recent weeks, has referred to the independent panel's recommendations as a platform for reform. He's been very, very supportive. And that also gives a bit of a leg up. So, watch this space. What we saw was that the libraries of public health departments at Harvard, everywhere else, are full of reports of previous commissions which made recommendations which were by and large ignored. So we're not letting ours go. We're continuing to pursue it. Because otherwise, if you don't learn the lessons of history, you're doomed to repeat them over and over.
Yeah, and I would hope that this pandemic has shown how vitally important it is to strengthen public health within countries, and how important it is for us to have a World Health Organization. Look at how quickly this novel virus spread to every single country, rich and poor. And, for this, we can't see this as something that we can tackle one country at a time. But as we think, the issue is the price tag often, and whether the wealthy nations will come up with a price tag. There's been an unwillingness to give to fund UN agencies at the level that they need, especially, I can just speak about the World Health Organization, at the level that it needs to function as an independent technical agency. And so more power to you. I hope that this crisis has been the opportunity for the kind of reform that we all need to see. We're all thinking a lot about the whole question about vaccine equity. And you mentioned already that, the countries in Africa just have just abysmally low, dangerously low vaccine coverage. And the donations from companies by wealthy countries just have been in no way up to the demand, the need to achieve vaccine coverage. Do you want to? I expect you addressed this with the panel. WHO, for example, is working with a laboratory in South Africa, seeking to replicate mRNA vaccine technology, a technology that has enormous promise, that allowed us to have a highly effective vaccine in record time, but one which remains proprietary.
Yeah, we had a set of recommendations geared at what was the immediate situation in May. And basically, they said, firstly, would WHO please spell out a strategy for where it thinks the world needs to be by what timelines to end the pandemic, because there wasn't such a strategy. So at the G7 meeting in June, Dr. Tedros sketched out the strategy. He said, by the end of September, I need 10% of the population of every country vaccinated. By the end of December, I need 40% of the population of every country vaccinated. And by the time the G7 meet in June next year, we need 70% of every country vaccinated. So that at least gave some kind of timelines. And he and Antonio Guterres have formalized that a little bit more recently, although there's a bit of slippage, I think, to now talking about September next year for the 70%. But hey, we're not on track for any of that either. No. Because countries like mine will head for 90%, while sub-Saharan Africa, much of it still struggles at around 5%. So then we made very specific recommendations about vaccine redistribution and scale up of manufacturing. And it went like this. Our analysis showed that when we were writing, which was at the very beginning of May this year, high-income countries like yours and mine, collectively, we had ordered twice as much vaccine as we needed. And we needed to redistribute that fast. And we said there was enough to redistribute 1 billion doses by September and another 1 billion by mid next year. Now, that's not the total answer, but it certainly helps for sub-Saharan Africa and other low-income countries.
Billion is more likely.
Yeah, to at least vaccinate their health workforce and their most vulnerable, to help get to the 20%, perhaps. Well, of course, it hasn't happened. The G7 talked the talk, but didn't walk the talk. And a lot of the pledges that you're hearing about redistribution, they're too slow. These doses are needed now. And the whole point is, as you know so well, and a lot of the audience, is that if transmission continues unmitigated, you run the risk of something worse than Delta, more transmissible, more deadly, more dodging the vaccine barriers that we're putting up. So it is really urgent. And one can only hope that the G20 leaders meeting this week might, stump up some more. We live in hope. Now, secondly, of course, there just hasn't been enough vaccine produced. And what is rather sad is that vaccines haven't been seen as a global public good. Companies are making record profits out of this, right? Look at Pfizer, look at Moderna. I mean, the profits rolling in are frankly disgraceful. And whatever happened to the ethos of Jonas Salk, who invented the Salk vaccine for polio, which I was a beneficiary of as a child in the 1950s when it was rolled out around the world and stopped the polio epidemic for most of us. Salk said when asked, would he become a rich man? He said, no, never. This is a gift to humanity. Well, frankly, these vaccines have been a gift to the shareholders of Pfizer, Moderna, and the rest of them. Disgraceful. And
U.S. huge government subsidies, I would add.
This is the frustrating thing, that these vaccines have all been the development's been supported by public money, and the opportunity was lost to leverage from that and say, in return for that, here's the conditions that you have to roll it out on. So the whole model is wrong. So we recommended that the vaccine manufacturing countries and the companies needed to be convened by WTO and WHO to try to hammer an agreement for scaled up voluntary licensing and rollout of production around the world. Those meetings have been occurring. There's some movement, as you say, South Africa, Senegal, Rwanda, but it's not fast enough. And we're going to need that rollout capacity on an ongoing basis, because we're not going to see the end of COVID anytime soon. We're going to need this round of vaccination, the boosters, this will go on for years. So we need to keep pressure on that to scale up. Now, there's also the move, which we supported and which the US administration has supported, to negotiate a waiver on intellectual property rights at the WTO, a TRIPS waiver, as it's called, which is being promoted by India and South Africa and other countries. Look, I believe, for the record, that whenever a pandemic is declared, intellectual property rights should be waived, because the public health imperative is the key one. Will we get to that? Very, very hard, but that should be the vision. Would we ever have been able to combat the AIDS epidemic as much as we have without the intellectual property waivers? No. So
we're almost out of time. We just got flashed that we have about a minute remaining, but I think that it raises so many questions about equity, around all kinds of access to technology. I'm thinking, I worked in Southern Africa, lived and worked in Zimbabwe during the years when treatment for HIV was unavailable. We were told that it was, for us, prevention was the strategy, meaning behavior change. And this is not right. It's not right that health workers are going to work in hospitals, unvaccinated, caring for people who have COVID. So I really applaud you and your co-chair, Ellen Johnson Sirleaf, for speaking truth to power and to bringing these ideas to the international arena. And I'm going to leave the last word to you. I don't know how many minutes we have. We're going to come up, I'm sure, on final seconds, and I have a few things that I have to say to the audience, but please, if you'd like, it's been such fun talking with you. If you'd like to say a few final words, I'd welcome them.
Well, really, really appreciate the opportunity to talk to a Harvard audience, and just hope that there's a generation of young people coming through Harvard who are going to be inspired by this greater global public good, with a commitment to seeing health equity for all. This pandemic has shown us how unequal we are within countries and around the world, if we needed reminding. There's some deep structural issues to deal with here, and we look to the next generation to do better than ours has.
Well, thank you, Prime Minister Clark. It's wonderful to have visionary leaders like you who've brought us the wisdom of years and the courage to face the future with hope and with conviction. I'd like to also thank our viewers and tell them that they should stay tuned for more Voices in Leadership this fall. And until then, thank you all for watching and be well.